hyperbaric oxygen therapy is a very safe therapy, but only when it's done in a safe manner. In this video, I'll share with you key points that I teach in my hyperbaric certification course to hyperbaric providers so they can ensure that hyperbaric therapy is very safe either in their clinic or in their home. To ensure your hyperbaric experience is safe, there are a couple of conditions that have to be met. First, your chamber needs to be very safe. Get it from a reputable manufacturer who has really good warranty and you know that they adhere to certain governing bodies that will certify their hyperbaric chamber. Second point to remember is that when the hyperbaric chamber is pressurized, whether it's a hard shell or a soft shell, when it's pressurized, inside is oxygen-rich environment. Whether or not we pressurize it with oxygen or air, this needs to be respected to avoid oxygen-related accidents. Do not take in a hyperbaric chamber anything that is not supposed to be there. Electronics stay outside of hyperbaric chamber, as well as anything that has battery in it. I have a full list of the items that are prohibited inside a hyperbaric chamber. The link is in the video description. Download it and have a look. Secondly, ventilate and clean your chamber between your clients. You want to ensure at least 15 minutes between your clients in order to ventilate the chamber properly. Inside the chamber, we're supposed to wear cotton clothing because synthetic clothing can create static and electricity, which we obviously want to avoid because remember, this is the oxygen-rich environment. And another point I'd like to bring to your attention that is often missed. Chambers are a piece of equipment and of course they break down and sometimes people attempt to repair a hyperbaric chamber themselves. Two of the very bad hyperbaric accidents that resulted in people's deaths occurred exactly because somebody attempted to repair a hyperbaric chamber and they were not the manufacturer, so it created a spark and then a fire started. If your chamber broke down, go and talk to your manufacturer. If you still have warranty, great. That's why I encourage you to get the chamber with good warranty status. If not, still, it's the manufacturer who is responsible for chamber repair. And last but not least, another mistake I see people make, they allow the oxygen for a free flow inside the hyperbaric chamber. They have an oxygen concentrator, which is supposed to be connected to a mask, a hood, or a nasal cannula, and a person should breathe that. But sometimes they take the mask off so the oxygen starts to flow freely inside the chamber, or they just feel that the mask is not comfortable, or maybe some people think that they increase effectiveness of hyperbarics if they allow oxygen to flow freely. First of all, the effectiveness of HBOT is not increased that way, but the dangers of HBOT are increased dramatically because you're increasing the oxygen concentration inside a hyperbaric chamber. So you're creating an oxygen-rich environment in which you have to be double careful to avoid any accidents to occur. Initial screening for contraindications to hyperbaric therapy is a step that is also often missed in many hyperbaric clinics, and that of course can lead to unsafe utilization of hyperbarics. There are not that many contraindications. There are 3 absolute, which is untreated pneumothorax, acute bronchospasm, and inability to equalize ear pressure. And with these 3 conditions, people should not be allowed in a hyperbaric chamber. There's also a list of relative contraindications, such as late-stage COPD or pregnancy or use of certain medications. And in the HBOT certification course that I teach, we go into details of each relative contraindication, and I explain how to approach it. Because relative means sometimes hyperbarics could be used and other times it could not. I have a link in the video description to the pre-registration list for Hyperbaric certification course. You can join the list. There's absolutely no commitment. You'll receive some very useful material about Hyperbaric, and also you'll be able to log the best price to the course. Now let's go back to our video and look into other mistakes people make or the steps that they miss that are not safe in hyperbarics. The most common side effect of hyperbaric therapy is ear barotrauma, meaning trauma to the ears. And this side effect could be avoided when proper ear equalization techniques are used and when people who cannot equalize ear pressure are not allowed to do a hyperbaric treatment, either at all or on that particular day. Ear equalization is very important. We teach it to everyone before they start their hyperbaric sessions, and we tell people that they need to do it every 15 to 30 seconds when the pressure inside the chamber is increasing, to make sure that they equalize pressure inside their ears and help them avoid side effect, the accident, the rupture of tympanic membrane, ear pain. I cannot even tell you how many phone calls and emails I receive every day of people asking me why they feel pain or pressure in their ears after a hyperbaric session, why their ears feel blocked and it's so uncomfortable. The reason for that is that the proper ear equalization techniques were not used during the pressurization and sometimes depressurization inside a hyperbaric chamber. Hyperbaric therapy safety starts with people who run a hyperbaric chamber. They need to be educated and preferably certified in hyperbaric therapy. Whether you run a hyperbaric clinic or you use a hyperbaric chamber at home, there's certain things that you need to know about hyperbarics, like safety points, contraindications, side effects, understand physiology, how hyperbaric therapy works inside the body, because that will ensure the safe use of hyperbaric chambers, and the chambers themselves need to be very safe. If you're interested about learning more about hyperbaric therapy, there is a link in the video description to HBOT certification course waitlist. There's no commitment. When you join the waitlist, you'll receive more information and you'll be able to lock the best possible price. If you have questions about hyperbaric safety, please leave them in the comments section.